Living Transplant is a podcast that takes you behind the scenes of the transplant program at Toronto General Hospital, with the goal to educate, inspire, and fuel your passion about transplant. I'm your host, Candice Coghlan. Thanks for joining us for Season 4. In this episode, I sat down with Justin Poy, a father, entrepreneur, and businessman who has lived with multiple types of renal replacement therapy since the age of 10, including 3 kidney transplants, hemodialysis, and peritoneal dialysis, as well as home dialysis. Justin and I spoke about mental health, resiliency, parenting with a chronic illness, and how to appreciate each day. Later, we were joined by Samantha Anthony, the first person to hold the title of Health Clinician Scientist in Canada. Transplant and Regenerative Medicine Center, Department of Social Work, Child Health Evaluative Science Research Institute at SickKids. We explored the medical journey and tools to support children, youth, and families created from the perspective of those who live with it. We also spoke about post-traumatic growth and the whole family journey. Please enjoy. Welcome back to the Living Transplant podcast. It is my absolute joy to have Justin join us today. Thank you so much for joining me.
Thank you.
I'm wondering if you can start off by telling us a little bit about yourself.
Well, I'm 53. Oh, actually, I just turned 54.
Happy birthday!
Thank you. July 7th. I was born in Toronto. And I went to university here, graduated in radio and television broadcasting, and then started my advertising agency. And I've been running my company for about 30 years now. And I'm married. I have 2 older daughters from a previous marriage, and I have a 8-year-old son.
So you mentioned there a little bit about your health journey. I'm wondering if you can bring us back to your childhood and talk to us a little bit about what growing up was like.
Every year, especially when you have health challenges, a year can seem like a lifetime. So when you add all 54 of them together, it seems like a very long time. But growing up, when I was pre 10 years old, before that, I had a great childhood. I was very active. I was really good in sports. In fact, I was an avid skier, an avid swimmer. I even got my instructor's pin in skiing by the time I was 11. Wow. And then I got sick. Mm-hmm. And so what happened was back in 1976, my parents wanted us to take a trip to China. And we went back to visit sort of our ancestral village and whatnot. And when we were there, I got a strep infection. And my father, being a physician, a surgeon at the time, he always carried medications with him, but obviously he couldn't do a swab or anything. He didn't know what type of antibiotic he needed. So he started sort of a broad spectrum antibiotic. I took it, but then I kept getting sicker, and they got me back to Hong Kong, and I got better. But then 6 months later, that was Christmas break, and by March break, I went to the washroom and there was blood in the toilet bowl, and so that's how quickly it happened. And I was actually really scared to tell anybody. I hid it from my family for a while because I thought I was dying. So I was 10 years old. I thought I was dying. I don't want to tell my parents. And but then eventually, what happened was I was going to the washroom like literally every 45 minutes. I had to tell my dad. He took a sample to his hospital, which was Scarborough General at the time, and they said I had to go in, and I went into SickKids. And at the time, they always aggressively tried to save the native kidneys for children. So they put me on, pumped me up with steroids, and I looked like all the kids you see on steroids. That was very tough. I would say that was my introduction to learning how to cope with not just the health issues, but the self-esteem issues and all the rest. I mean, it's very tough as a kid to begin with. And I would have been 11 at that time, and 11, 12. So that's already a tough time. Yeah. And then by the time I was 13, I was told that I had to go on dialysis. And at that time, I chose peritoneal dialysis because, the belief was that peritoneal is a little gentler, you'd be able to grow more. And so I went on peritoneal dialysis. And back then, the waiting list was very short. I was on the transplant list. And actually, within 10 months, I got 2 calls. The first call came within like 4 months. And that my mother actually declined it because apparently it was from a baby, and the kidney would have not have been enough to support me right away. So I would have still had to stay on dialysis for a year. So they said, better not. My mother passed on that one, but then 10 months later, on Christmas Eve, I got my first transplant at SickKids. Yeah.
Wow.
And
what a gift.
yeah, it was pretty amazing. I tell people the story all the time. I remember waking up and Santa Claus was at the end of my bed in ICU. We had all these gifts. So I spent Christmas and New Year's in the hospital. I spent a lot of holidays in the hospital. And then I went home, but again, back then, the way they managed medication when you have a transplant, with all your anti-rejection meds, especially the kids, they really pumped us up. Obviously, they want to make sure the organ works. And so, I was on a lot of steroids again. And I'll tell you, and by that time, I was 14, 15, 16. That's when, you want to look good, and it was rough. That was really, really rough. Side effects from medications can actually sometimes be worse than the illness itself. Because back then, I know they don't use cyclosporin for renal transplants anymore. They use them for liver transplants. But I was on a lot of cyclosporin, so I was 14. I was shaving twice a day, and I had these big puffy cheeks, and it was bad. Like I would say that when I went to clinics, most of my complaints were actually about the psychosocial issues that were happening in my life, and not so much the physical issues. The physical I could totally handle, but it was more, look at how I look. Like, how do I fix all this? I remember I was having a lot of, emotional problems when I had my second transplant, and I went to the nurses and I said, "Is there anybody I can just talk to that's been sick since the early '80s?" And they even had trouble in finding somebody who was alive still. And I said, well, all the people I know are dead, so I can't talk to them. I said, I'd like to talk to somebody who's been struggling with this for over 25 years. And they didn't end up finding a girl. It was funny. She and I ended up were in camp, a dialysis camp together back in the 80s. And they put me in touch with her. And we've kept in touch. But it's a different journey when it goes on for decades and decades and decades. And when you lose like 2-3 transplants, then there are a whole bunch of other issues that you face that you didn't have to face the first time around. I try to keep my mental health. I focus as much on my mental health as I do on my physical health. What was it? Maybe it's got to be 15 years ago, I got cancer. And it was just, they had deemed it was from all the years of being on immunosuppressive drugs. That time though, and plus I was on dialysis. So like, I remember after that first appointment at Princess Margaret, I was like, great, I'm on dialysis, I've got cancer. And it seemed overwhelming until I just said to myself, you know what, done all this before, I can do it again. And I just trucked right through it. If it wasn't for all those years previously being on dialysis, I wouldn't have gotten through that. And I just chalked that all up to mental health, like being in a good place. And I don't know. I mean, everybody's got their own constitutional makeup, and I know I've used the support system. I actually used to lead a peer support group for the Kidney Foundation, and sometimes as a leader of the peer support group, you actually get just as much as the people in the group. In fact, more. Yeah. And so I've just learned a lot of these skills throughout the years, and I think that everybody's got to try and figure out how to learn those skills, because all sorts of curveballs are going to be thrown at you, right?
Mm-hmm. Yeah. So when you were a teen and you're going through all of these changes, how did that impact your daily life? And you talked about having all of these feelings, and how did you manage all of that as a teenager? And I guess I'm maybe asking you this for any of the young people who might be going through something similar, who are looking to you for some thoughts and advice of how you managed it.
So I've said this to many people before, that actually I don't look at kidney disease or anything that's happened to me health-wise as an impediment. Actually, I look at it as a gift. Honestly, I would not be the person I am today if it wasn't for that. I think that, and by the way, going on PD as a kid didn't help with the growth spurt. I didn't grow at all. So, being shorter than everybody, being smaller than everybody, looking a little different. If I couldn't compete on the same playing field that every other kid was competing on, then I found something else that I could do that was my own thing. And that's exactly what I did. So I've always been artistic. And when I felt a little socially awkward, I just delved into my art. And I gained a lot of respect among my peers for the art I created and winning awards and things like that. So I think if you just turn your focus to, it can actually help you focus on another part of your skill set than relying on your looks or, relying on your strength. It really made me look into me and even drove me to the career I do today. Like if it wasn't for kidney disease, I guarantee I wouldn't even have my ad agency. I would have probably done something completely different, like my brothers. I probably would have gone overseas and worked for some, corporation.
I think that's such great advice from you to, rather than looking at everybody else, turn inwards and, find what makes you feel like you're lighter and brighter and more yourself. And, that helps you focus on something other than, I guess, what you're going through at the time.
My biggest message to people who run into any type of chronic illness, especially something like dialysis and transplants, where, if you're young enough, you're going to live with it for a long time, is that the psychological aspect and the emotional aspect is probably bigger than the health. And so I've always looked at it like this. And I actually really like the term, and I don't know when they created it, but renal replacement therapy. Sometimes the transplant, sometimes it's dialysis. So I look at it this way. Sometimes you have a transplant, sometimes dialysis, the life just keeps going. You don't stop. I lost this transplant. I had it for 15 years, this kidney, which was from my mom. And I lost it right at the beginning of COVID. But I didn't skip a beat. Like I just said, okay, well, life will be different now. And I literally, in fact, I do more now than when I had my transplant. I never skipped a beat at all. I just kept going. And I look at, I'm very fortunate. I'm on the nocturnal chemo program, so I have a machine at home. During the time that I'm setting up, I just look at it like, like as if you have to go to the gym or you have to make dinner to get ready for bed. It's just part of my bedtime routine, a little bit longer. I have TV in the room and turn the TV on and watch news. And you just get set up. And in the morning, you get up a little earlier and come off the machine. And it's really, I think that has been probably the healthiest aspect for me, to be able to look at whatever is happening, just accept that that's the way life is right now. So you don't have to put on hold anything, because that time may not come, right? And with the transplant waiting list these days, and not everybody can find a living donor, the wait can be long. I can't even imagine what it would be like to put your life on hold for 5, 6, 7 years, thinking that all these amazing things are going to happen when you have your transplant. And to be honest, some people, when they get the transplant, they don't even feel that great with the transplant. Like it's a different form, but either the medications or whatever, they just don't feel good. So
I agree with you. It's whatever part of our journey we're on. I think some people don't realize that, it's a lifelong journey. Transplant's not a cure. It's not the end of our problems. It's not the end all be all. And for some people, transplant, doesn't ever work, or it doesn't fit in their life either. For some people, they live their entire lives on dialysis and they're able to manage very well. And, that's how they do it. I think, the more we talk about it as this lifelong journey that we're on as kidney patients, and like you said, finding ways to have it be part of our life instead of stopping our life because of it. I'm wondering, you spoke about, you have 2 brothers, you've got children yourself. How does your family work into this whole mix? Because, everybody who I know, it's less of an individual journey often when we are living with a chronic disease, and more of a family journey, right?
Well, the way I look at it, and I've always looked at it as a kid, that this is my problem. So I don't want my problem to affect anyone else around me negatively. My mom, even when I was a kid, has always offered me her kid, but I had a lot of calculations in my head even as a kid. And as a pretty mature kid, I thought, I got 2 brothers, they need my mom. So I refused it every time she offered. And it wasn't until after my second transplant failed, I was on dialysis for about 7 years, I decided, okay, maybe it's time to consider another one. And my mother just happened, I never asked her to come. You go for your appointment with the transplants or doctors. And I was actually going to bring my ex-wife. and then my mom said, no, don't bring your ex-wife. You should bring me. So I said, okay, fine, come. I bring in my mommy. I'm like, at the time I was like 40, but anyway, so I come with me. And and it never dawned on me to take a living person's organ. Like, it never dawned on me that someone should even have to experience a minute amount of pain for me. We were sitting there, and my nephrologist turned to my mother and said, oh, has anybody in the family ever? I was like, oh, don't bring this. Like, Anyway, my mom was like, oh, is it still a thing? I'm not young anymore. And my mom was in her 60s at the time. He said, oh, yeah, no, we totally could. So then we went down to the lobby at Toronto General and talked about it. I said, look, you know what? I'm not going to make the decision for you. She said, I've done everything in my life that I've wanted to do. This is the one thing that I've wanted to do and I've never been able to do. Oh. So I said, hey, let me think about it. And I thought about it. About a month later, I called her and I said, all right, if you really want to do it, we can do this. And so we did the workup, that decision-making process. But I mean, my whole thinking as a kid was always, this is my problem. I don't mind support and help, but I don't want it to affect anybody negatively. Right. And because I'm already affecting them negatively enough as it is. And I would say, when it comes to renal replacement therapy, this nocturnal dialysis program that UHN has, that's like a total game changer. Like, when you talk about dialysis meaning you with, peritoneal dialysis, or you on a machine, that's just one aspect of it. But I used to, when I was in university, I had to go in center at Toronto Western, wait and do it in the evening. Yes. You get home at like midnight and then you got to get up for class. That versus doing it at home is night and day. And also being able to dialyze so frequently versus just 3 times a week. So all of a sudden, I went on this nocturnal program, there's no more diet. I eat and drink as much as I want. You feel good all the time. There's no bad days. And that's a huge thing. So while the machine, the technology hasn't really improved in the last 40 years, the way they manage it has improved. And we have one of the best systems in Canada. Everywhere I travel, when I explain to them how Ontario does nocturnal diet, people are blown away. Even other provinces. When I was in Vancouver 3 weeks ago for a conference, and I was at St. Paul's, and they put me on the machine, and they were asking me questions. They said, so do you have like this little machine? I said, actually, I got the model that's higher than the one I'm using here.
Yeah. At my home.
My machine's better than this one. And they're like, you have that at home. I got it home right next to my bed. And we're very fortunate here. Very, very fortunate. I've never taken that for granted.
Yeah. When I was on dialysis, I did about 5 months in center hemo, and then I switched to home peritoneal. And
what a difference.
Yeah,
right?
what a difference.
What a difference.
And the thing that stuck out to me was always the goal of the teams was to find what worked best for me. And like their innovation and, being on top of their toes all the time with the changes in what my machine would tell them and, how my clearance was, and just their goal was always to make our journey as easy as it possibly could to be part of our lives rather than taking over our lives.
Right. So, I mean, because if the goal is just to keep us alive, pretty easy to do. Yeah. But there'd be a lot of miserable people out there.
A lot. Yeah. Absolutely. I've heard you speak before about your reluctance to talk about your journey. And, I'm just wondering why that is, to keep that separate.
How can I say this? So, I mean, I've been volunteering for the Kidney Foundation for a gazillion years. I was on the board of Trillium Gift of Life Network. It's not so much that I was trying to hide anything, just that the world is funny because I'm in business. And I have my family to support. That does guide a lot of my decisions. If at the time that COVID started, and that was when I was losing my transplant, if I had come out publicly and done these kind of things and said, I'm getting sicker, I'll be on dialysis in a few months, I can honestly say I would have lost a lot of clients. People are just that way, and we're human, right? You're working with somebody and they say, listen, Candice, I'm really sick. the last thing you want to do is like, yeah, well, I got another job for you. And you make sure you hit,
Right.
right?
Right.
You're going to
Yeah,
be
I
like,
guess so.
okay,
Yeah.
maybe I better give this project to someone else. But if I tell you now and a client says, well, are you okay? I'll say, listen, I've been sick for 3 years. I've been on thousands. Did you notice anything? No. So let's get on, right? So I've always been like that. I will wait for a prescribed amount of time. And then when nobody knows anything, I don't care if you know, because at that point I'll say, if you didn't notice anything in the last 2 years, you won't notice anything in the future. As far as living donation, well, I never spoke about it before because I never had the experience. But honestly, my eyes completely opened up. So after my mom donated, and she was not a young woman, she was already in her late 60s. She recovered very quickly, and her health is fine. So this time around, as I was losing my transplant, a client / friend of mine went online and was just doing some research on me for my company. But then these articles came up saying that I had a transplant. And so she just out of the blue just said, oh, I read this, like, how are you? And I'm not going to lie to people. I said, well, that part of my life is not great. And she literally just came out and said, you know what? Like, can I donate one? I was like, oh, come on, don't just say that. But she was very genuine. I kind of did what normally the social workers do. And I really ran her through the grill and said, look, like, you have to really know what you're talking about. And she and I had many talks. She said, this is something I've always wanted to do something like this. I think it would add a lot of meaning to my life. And I said, wow, okay. So we talked a lot about it. She's a very dear friend now. And so she's going through the workup. I'm pretty much done. And now we're not a match. So we'll go into the paired kidney exchange and see how that goes. But in the meantime, I'm just putzing along and doing everything I normally do. And when that happens, it happens.
So, you've talked a lot about, things that you've been through. And as a parent myself, I have a 2.5-year-old. Right now, she doesn't know the journey that I go through. She doesn't know that I take medication. She doesn't know why sometimes I'm in the hospital or, why I have to have certain procedures. You've had this journey with 3 different kids now. Do you have any advice for, how we talk to our kids at some point, right?
Well, I mean, when I was on dialysis, I had a massive machine in the room. My girls were young at the time. They clearly saw it. At the time I had a fistula, so they saw me putting needles. I actually showed them everything. I said, look, I'm putting the needles in. I didn't want them to be squeamish about blood and needles and everything, because there were always, biohazard bags in my room and having to take them out to the garage. And I feel like when you explain things to kids, it lessens the fear. I mean, I try to teach them at a level maybe a little bit higher than I thought they could handle, because I wanted them to understand. I didn't want to sugarcoat anything. And when I went in for my transplant, that part, my daughters didn't fully understand, but they really appreciated when they saw the machine gun. And that was, and then they got it. They couldn't understand why they couldn't just travel with me before and stuff. And, with my son right now, it's kind of the opposite. Well, he sees me on dialysis, but he's never known the transplant side of things. With him, I remember the day the machine was moved in, and he was 3, and he just popped his head in and he thought it was a robot. And I didn't have time to explain it to him. So I said, yes, it's a robot, right? And he said, oh, cool. And then he left the room. But now he does understand it. And it's great when kids ask questions, because I think that it's important for your kids to fully understand what's going on. I think it sometimes parents say, well, I'm not going to tell them because I don't want to scare them. I think honestly, it scares them more if you don't tell them something and then they find out on their own, or something bad happens and it just hits them like a brick wall because they had no idea at all, anything, right? There's nothing wrong with kids knowing more. I would feel bad if I kept my kids in the dark, and they didn't know anything. I'd feel bad. Also, they wouldn't be very sensitive to you. I mean, imagine if your kids grow up and they don't really know what you're going through and they say something completely insensitive, you want them to learn. I always feel like if you're a family member and you're going through something, maybe they're not going through the same thing, but at least let them have the benefit of learning from you, right?
Right. Yeah, that's beautiful. So before we bring on our next amazing guest, I'm wondering if you have any last advice that you'd like to share for either kids who are going through a health journey or parents of kids who are going through that health journey.
I think I've talked about sort of the patient side of things, but as a parent, now I've never been a parent, as sick as I've been as a child and seeing my mom go through what she did, I would be devastated if any of my kids were sick. My kids are all super healthy. I honestly don't even know how I would handle it. Like I get sick to my stomach even when I see my kid hurt himself. So I would say though that as a child and seeing my parents go through it, what my parents did right was, well, number one, they were very supportive, and we talked about everything, like literally everything. There was nothing hidden, and I think that is a huge thing for parents to know that, as a parent of a healthy teen, you already don't talk much, so you are in some chronic illness and you might not be communicating at all, right? So I would say that the communication part, and seeing how my parents communicated with me, especially my mother, that's taught me how to communicate with my kids now.
That's great advice. Thank you, Justin. Now I'd like to say thank you so much, Justin, for joining us today and for sharing your amazing journey and all of this insight, because there's a lot of people out there who can benefit from hearing about how you keep yourself positive and the incredible success that you have in your personal life. And it's amazing being able to hear your journey and see you and your mom in the Great Actions campaign, because a lot of people are watching you and cheering you on. So thank you so much for joining us. So I would like to introduce Samantha Anthony. She is a Health Clinician Scientist, Transplant and Regenerative Medicine Center, Department of Social Work, and Child Health Evaluative Sciences and Research Institute at SickKids. Thank you so much for joining us today.
Absolutely. Thank you very much for inviting me.
Awesome. So I'm wondering if you can tell our listeners a little bit about yourself and specifically why you decided to specialize in social work and pediatric transplantation. That's quite a specific area of focus.
Absolutely. So as you mentioned, I'm a health clinician scientist in social work, and I'm actually the first and only right now in Canada. So very privileged to hold this position. So with regards to why deciding to pursue a career in social work, I always knew I wanted to work in pediatric healthcare, and social work aligned with my core values. So think about respect for the inherent kind of dignity and worth of others, pursuit of social justice, and service to humanity. As a member of the interprofessional health team, social workers bring a holistic approach to the examination of the biological, psychosocial, spiritual, cultural factors influencing physical and mental health, and also with an emphasis on the social determinants of health and mental health. Social workers strive to enhance well-being, empower clients, promote social change, and advocate for equity and access to services. With regards to transplant, in all honesty, I kind of fell into transplant. So I didn't have any prior experience or knowledge of the field of transplantation. Following my graduate training, I applied for a job at SickKids in the nephrology program, and then had the opportunity to work within renal transplantation. Then I transitioned into the heart transplant program, and now I'm currently working in the lung transplant program. So over the last almost 25 years now, I've definitely grown to be very passionate about the field of transplantation. And as a clinician, what I really like is that patients come to our team with life-threatening diseases, and though the future after transplant can sometimes be uncertain, it's filled with a lot of hope and represents a second chance at life. And in pediatric, quite different from UHN, our transplant programs tend to be much smaller in numbers. So we have the opportunity to work very closely with patients and families and develop strong therapeutic relationships that are long lasting. So many of the families that I work with, their children were referred to our program as infants, and we follow them right until they transition to adult care at 18 years of age.
For sure. So talking about, the child's life and, working with children and their families, often we learn about the children's journey through their patient or through their parents, sorry. So how do you get the perspective of a child's journey through transplant, and what does that information give you compared to hearing it, secondhand from a parent?
So you're right. Historically, transplant stories have only been captured from the perspective of parents or healthcare providers.
Hmm.
And these have often been, primarily focused on physical functioning and looking
Hmm.
at kind of quantitative data, so survival, morbidity, mortality. And as Justin mentioned, we often don't hear the experiences from the child's perspective, with a focus on some of the aspects he had about the psychosocial implications. So
Hmm.
psychological impact, navigating social relationships, especially during those adolescent years.
Hmm.
So within our lab, our overarching goal is to examine those biopsychosocial kind of impacts on patients as well as families to improve health outcomes by transforming clinical practice. And when you mentioned how we go about that, three kind of overarching aims of our program is to engage patients meaningfully. So focusing on patient identified priorities and integrating their experiential knowledge through patient-centered partnerships, capturing the patient's voice. So exploring the illness experience from the perspective of those who live it and those who create meaning from it. And lastly, advancing implementation science. So promoting the development, evaluation, systematic uptake of innovative evidence-informed interventions into clinical practice. And one of the things we do, our team's well known for primarily focusing on qualitative research methods.
Hmm.
So really spending time interviewing patients about their experiences, asking them about what matters most to them. And again, valuing and trusting their experiences and their stories. Parents, again, are pretty good at assessing physical functioning, but they struggle a bit more around understanding the realities of psychological and social relations
Hmm.
of the children. So again, their assessments are incredibly valuable and important, but it does make a big difference when you actually turn to the children themselves about what matters most to them. And then having that information influence care,
Hmm.
right? And the
Hmm.
plan of care.
Yeah. Like Justin said, with teenagers, we often get one word answers out of them. How was your day? Good. What did you do today? Nothing. Right. So, and
Exactly.
getting to have a team like yours to actually explore what is going on from their perspective and sit down with them and take the time to really have them open up, I'm sure is, you know, quite valuable to know from a social work perspective, and just a holistic approach as well, right? Because we know at UHN and at SickKids in many places, we're not just treating the symptoms or the disease. We're trying to treat the whole person as the journey that they're going through, instead of, as we talked about, just their physical body.
Exactly. Exactly.
Mhm.
Yeah.
Mhm.
We've recently, our team has created an electronic patient reported outcome measure platform called Voxy.
Okay.
And one of the objectives aligns with what you're talking about, how difficult it sometimes is to engage patients in conversation.
Mhm.
This allows patients the opportunity to complete outcome measures looking at domains of functioning that are important to them. They
Mhm.
can complete these outcome measures in advance of clinic, and it's on an app that was developed by patients for patients. So it's very kid friendly.
That's
So it's
awesome.
got, gifts integrated throughout to encourage them to share their voice and perspectives. So it's a way to, again, when they come to clinic, we have some data that they've already shared that we can use
Mhm.
as a springboard for engaging them in conversations about how they're doing. Because again, when they come to clinic, exactly like you mentioned earlier, how are you doing? Fine. How's school? Good.
Right.
Right?
Yeah.
You need that element of curiosity and to probe a bit further. And we were quite surprised, actually. A lot of the interviews we do, we think they'll be difficult to engage. Once they get going, people
Mhm.
often want to share their stories. And they find by sharing their stories, it's actually therapeutic in of itself. And even as Justin
Mhm.
mentioned earlier, many of the patients that we work with haven't met other patients who have undergone transplantation. So to have the opportunity to potentially share their
Right.
experiences where it might benefit others is really meaningful to patients.
Mm-hmm.
So sharing some of the more difficult, areas that they've had to navigate, as well as even what Justin mentioned, some of strengths, highlights. I think often we focus on the negative aspects, but many of these patients do talk about many of the benefits of undergoing transplantation.
So being able to talk to somebody who has this as a strength, or an app where, we can quietly do this by ourselves rather than have to engage and open up with a bunch of people, might be a safer way for people to do it. Yeah.
And even the study participants have talked about the fact when you come to clinic, you're in a very different headspace. You might be undergoing different tests and procedures that day. You might have had to get up early to get to the hospital that you're being cared for at. So if they have time to reflect in advance.
Mm-hmm. Wow. So transitioning from SickKids to UHN or other adult centers is a huge life event for most patients. How do you prepare patients and families for that journey of leaving, the cozy home that is SickKids to going out into the big wide world?
So you're right, it definitely is as I mentioned earlier, like a pivotal stage in the ongoing management of transplant recipients, and not an easy one. So from a clinical perspective, I think what's important is that transition planning is recommended to begin at an early age, so usually around the age of 12, and really focusing on increasing the independence, knowledge, and involvement of the adolescent in their own care in order to equip them better for the adult care system. Many years ago, we actually conducted a study. It was published in the American Journal of Transplantation, where we asked patients and parents about what were their needs around transition. And they definitely mentioned, ongoing communication and collaboration between the pediatric and the adult practitioners. So again, they recommended a cohesive transition plan, that there potentially could be joint visits between the pediatric practitioners and the adult practitioners, at least for an initial period of time. The other thing as a scientist that we're currently investigating, again, which aligns with Justin's experience, is looking at the implementation and evaluation of mentorship programs. Really important, both for mentees and for mentors. So we've recently implemented an online peer support mentorship program that provides modeling and reinforcement by young adults who have recently transitioned, so those between the ages of 18 and 24. And they are mentoring adolescents between the ages of 12 and 17. So again, our findings have been phenomenal, the impact of this program. The program addresses feelings of isolation, fosters a sense of connectedness and understanding. And again, as I mentioned earlier, hearing the stories of someone else who's been through a similar journey offers reassurance, encouragement, as well as hope.
Amazing. I'm wondering, Justin, if you think, if you back then would have had access to something like that, a mentorship program, if you think that would have helped you through that transitional period.
I would say, honestly, the biggest shock for me was actually when I had to go and stay as an inpatient. So being an inpatient at SickKids, and then the first time I stayed as an inpatient at TGH, I was just like, oh, okay, this is different. Because they're just the way the nurses and doctors are trained to talk to kids, and it's very different. I would say that was probably the biggest shock for me. But when I was part of the program at SickKids, we had social workers that they asked us to do lots of group activities. Actually, that was a way for us to meet other patients who are our age, and there's a lot of people, especially parents, they feel isolated. They don't know who to talk to, and not everybody's that social. They won't, at clinic, they won't turn to another parent and say hi.
Right.
So the social workers back then created a lot of opportunities for us. We go to parks and have picnics, and so we got to talk to each other, and it gave us a resource. So I had in my phone book, I had a whole list of kids that I could call if I, had a question or something. I remember there was one guy who transferred to adult hospital a year before me. So I did actually speak to him a lot after. So that might have been why it wasn't such a brutal transition. When I moved over, I had him to talk to. Yeah.
I can't remember, Justin, did you mention you had gone to camp or no?
Yeah, I went to I guess back then it was called Camp Dialysis. It was up in Halliburton, and we rented a camp along with hemophiliacs and asthmatics. So there were transplant, dialysis, hemophiliacs, and asthmatics. And we were all at camp at the same time. And it was only one summer, and it was the best. Honestly, I remember every part of that camp. It was the best experience of my life, because after my transplant, I felt like I didn't necessarily fit in at school anymore. I remember because I went away, came back like 3 months later, and all of a sudden everybody was taller than me at school. And I really felt out of place. So when I went to that camp, it was just like a very safe environment. It was great. And that was run by the Kidney Foundation. That really was a great experience. Yeah. But I think I always encourage people to get involved. If the program's there, it's there for a reason. So do it.
Camp, I think, is an amazing intervention, and definitely would be one of the psychosocial supports that helps around transition and feeling connected to peers. I think one of the things that we notice outside of renal transplant, we have smaller numbers, say in heart and lung, that often these patients live in very remote regions of Canada. So one of the nice things of the mentorship program, it's all online. So really thinking about how to use technology, that's been really helpful, especially, just coming out of the last 3-4 years of the pandemic, about the added isolation for patients and the increasing kind of concern around mental health issues has definitely led us to kind of look at different interventions on how best to support patients and families.
And Justin and I, we talked about kids and our parents and, all of the people that are part of our journey, as much as we're the ones who go through it. It really does impact the whole family and everyone who's around us. So I'm wondering, as a social worker in your role, how do you support that whole family journey? And do you have any advice for that family journey that they're going through at SickKids?
The parents' quality of life is definitely impacted by the mounting demands and stressors associated with their child's chronic illness. And research has demonstrated clinically significant levels of psychosocial risk for poor mental health outcomes. And the health of caregivers also impacts family functioning and patients' health outcomes. So really at SickKids, mindful of providing family-centered care. So thrilled that, as I mentioned earlier, the iPeer-to-Peer program that we launched, we've now expanded it to the iParent-to-Parent support group. So we're just getting ready to launch this. Again, very mindful of, as you mentioned, the impact on parents. And we also have recently had funding from the SickKids Labatt Family Heart Center, and we recently piloted a mindfulness-based retreat as an intervention to enhance community building, mental health, and quality of life amongst mothers of heart transplant recipients. And findings have supported that this retreat has been an impactful intervention. And next steps would include investigating potential expansion of the program to other clinical populations, including, other caregivers. So when we actually did the recruitment for the study and we were inviting mothers, often the fathers were saying, "And what about us?" So I think they often do get forgotten. And as well as siblings. So very mindful of that's another group that's really important within the circle of care, to what are their perspectives, what's the impact, and supporting them throughout the journey. All of the research we have, we work with patient partners. It's patient-oriented research. One of the benefits of being a health clinician scientist is that I still am involved as a clinician. So I work very closely with patients and families, and they share with me their concerns and their needs, which guides the research that we do. And so I kind of step away from my clinical practice, do some of the research and evaluation, and then can readily translate the knowledge back into policy and practice fairly seamlessly, because that's what I do, which is really the benefit of these health clinician scientist roles within healthcare.
Yeah, that is so unique to be able to do that. So, often with a health journey, we focus on the negative things that can happen and what we go through. But there is this concept of post-traumatic growth. Can you talk to us a little bit about that and how that impacts transplant patients or people who have been through a health journey like this?
So absolutely. So the concept of post-traumatic growth has been around for a long time, and really within the field of transplantation, it stemmed from my PhD research, where we interviewed adolescent heart and lung transplant recipients. And their narratives started to illuminate themes that aligned with post-traumatic growth. So some of the themes that emerged from those interviews were, awareness of personal strengths and coping abilities, courage and confidence to explore new opportunities following transplant. They spoke about relationship growth, so a greater appreciation for family and friends, more meaningful time together. They also spoke about kind of this introspective growth, so the sense of self, so developing a different, and maybe this is when Justin talked about kind of life philosophy, this increased gratitude for life, living life more purposefully. And when we spoke to the kids, I remember interviewing them, they seemed mature beyond their years. So this, overall transformative experience, the changes that happened, not only physically, but emotionally, spiritually, and socially. And one of the adolescents spoke about kind of a transplanted self.
Oh, I like that.
Post-transplant, exactly. That transplantations can be viewed as a catalyst for positive growth and personal change. So as you mentioned, I think we often focus on the negatives or the problems associated with transplantation. I think this is a very different approach, to very strength-based with regards to practicing as a clinician.
It's a very positive way to think about, some of the more difficult days that we've had in our lives, to look inward and think about what the growth has been.
One thing that, and this borders on cliche, but one thing that I'm very aware of is that anytime there's been a horrible period in my life, it never lasts. And every time there's a great period in my life, it never lasts. So I try, even when things are bad, I've actually kind of trained myself to absorb just how bad it is. Like, I remember there was a time I was in the hospital. It was horrible. I mean, they're all been horrible, but it was particularly horrible. And it was miserable. It was winter out. It was depressing, and I was in the hospital. And I just said, I'm just going to absorb just how gross this is, so that when things become good again, I'm going to enjoy it so much. And that's how I've grown, really, through the experiences. And because when I was a kid, I used to say, "Oh, I wish this never happened to me." But as an adult, I've never once said that. I've never once questioned fairness or why did this happen to me or anything. I'm actually really glad it did.
So Samantha, we've talked a lot about different aspects of the medical journey and your perspective with your team. What's next for your team?
I think right now, we're definitely looking at technology. So we have some new funding looking at AI. Again, we're looking at implementing Voxy. Voxy has been selected as the platform for the SickKids mental health strategy here at SickKids. We also have been approached from many other institutions, as well as actually adult centers, around potentially implementing Voxy 2.0 at an adult site. I think continuing to explore the experiences of families, looking at creative interventions to support families. That's always, again, the heart of what we do.
Like when you're talking about like mentorship programs and things like that, do people self-identify and say, I need to talk to somebody, or is what you do, is that offered to
both? Both.
Oh.
And a lot of it right now, it's often very difficult to implement clinical programs without evidence. So I think what we've been very fortunate of is that we've been able to secure funding, implement and evaluate the program, show that it's effective and the impact it has on patients and families, and then move towards clinical implementation. So that's kind of, when you ask what's next, I think we have these amazing programs. It's now translating into practice. And that's some of the work we're doing right now within the institution. But again, want this to be available to everyone. I find often within research, you do get, a very similar population who has the time and volunteers to do research. And we really want to target, patients and families whose voices are often not heard. So a lot of the research now looking at how can we implement these programs in different languages, right? Being mindful of Indigenous health and incorporating lessons and learnings from different communities into our programs, diversifying our patient partners who are advising us around directions that we need to be taking as researchers. So that's some of the work that we're doing at the present time.
Yeah, just a thank you to all of the social workers, to yourself, and all of those people who support us through our journey.
Well, thanks so
Well,
much.
I'm really glad that these social programs have evolved.
Yes.
Because I remember, back in the early 80s, there were many times I would voice certain things that were not medically important.
Right.
And all I would hear is, look, your blood work looks fine. So
right.
Right. And I'm like, yeah, but I look horrible.
Right.
How can I fix all this? And I had to solve all these problems on my own. And I just really like that everybody, that the community is listening to patients and that it's evolving, because especially for kids, it was so hard. Like it was so tough. And when I look back, 90% of the problems I had nothing to do with the actual kidney disease itself. It had everything to do with the social problems that it created, medication side effects, lifestyle being impeded. Like everything it was all the packaging around it that was actually the biggest problem. Yeah.
Absolutely. Well, thank you so much, Samantha, for joining us on the podcast today. We're so grateful to have you and for all of the incredible work that you continue to do. And if people want to learn more, I will put a link in our information as well. And Justin, as always, it's always a pleasure to chat with you and get time with you. Thank you both so much.
Thank you.
Take care. Thank you.
We hope you enjoyed this episode of the Living Transplant podcast. If you did, please leave us a review and share with your friends. Don't forget to subscribe to Living Transplant wherever you are listening today. If you have any ideas for podcast episodes, you can reach out to us at livingorgandonation@uhn.ca or on social at GiveLifeUHN. For more information about living organ donation, you can visit us at www.livingorgandonation.ca. Special thanks to Lead Podcasting for editing this episode and for production support. Thanks to Paula Neves, our advisor to the show. I'm your host, Candice Coghlan. Thanks for spending your time with us.